for a while, John was working in community mental health spaces, and maybe you want to address this question, John?
Yeah, sure. Yeah, I think one of the ways that I think we started talking about this years ago between Matt and I, and one of the sort of overlaps between work that I did in community mental health and some of the work that Matt had been doing about disability was a sort of recognition when I was in community mental health, like how institutionally bare those institutions were. So there was a recognition of illnesses, but there was really no, sort of solid institutional space to support people. I mean, this is in the United States where I think a lot of especially low income people were, sort of relegated to, impoverished districts, and their mental illnesses or their psychoses were really naturalized. And so I think, I guess the concept of disabling social conditions really resonated with me in this way because we really have a lack of spaces for people to be able to describe their experiences or any real interest in providing for people's needs. And so, I mean, in the context today where we have a sort of expansive discourse about, especially young people are talking a lot about depression again, I think has sort of reemerged, and there's a loneliness epidemic. I think I think we need new tools and new strategies for, not just describing these states, but for linking them to certain kinds of institutional problems that we're facing. And so I think like if we're talking about community mental health, I think Matt and I are also really interested in thinking about the way that neoliberalism has really hollowed out a lot of our social institutions, and it places certain kinds of, productive pressures on people. And so, by looking at disabilities and expanding our discourses about that, I think we're also trying to, work against that. I don't know if you want to say more about that, Matt.
Yeah, I just want to remind you that we're talking to Canadians who live in a socialist utopia, right? And so everything is fine there.
We would differ on that.
Yeah, I know. In some ways, I think so when I started working on the project that became Unraveling, part of that was field work in special education facilities in the Bay Area in California. It was really in San Jose. And there it aligned with what people were thinking of as the explosion in autism diagnoses. And what quickly became apparent to me was that autism in that context was a diagnosis that you could get that would unlock institutional resources for parents to support their children. Because in California, if you were autistic, it entitled you to special kinds of services. But if you were any number of other things, you didn't receive the same resources. And so being at a special education school that was dedicated to children with autism, it was very obvious to me coming from neurology clinics that those kids were not all autistic in the way that is diagnostically meaningful in terms of their treatment. It was a diagnosis that parents could seek out if they had the resources in order to unlock those additional resources, right? And I continue to be troubled by all of that because on one level, I kind of feel like everybody should get all the care that they need and support in their educational context, but they shouldn't need to go through the process of being diagnosed in that way, right? And I think that that's to kind of go back to where Allison started, that one of the things, it shouldn't be the case that everybody needs a diagnosis in order to receive the kinds of support that they need. And so I think it's especially tricky with people who are nebulously impaired or disordered, right? Or acutely disabled or impaired in some ways, right? That if people move through periods of intense depression or psychosis in some ways, but otherwise they don't need those kinds of support, it's harder it becomes a barrier to support those people, right? And thinking about how can we organize institutions in order to provide more latitude in the kinds of support that people receive without the need to invoke one's impairment or one's disability or one's marginal status, I think is really important.